The participant that took part in this observational study was a 19-year-old female childcare worker who resides with her parents. She was a non-smoker, had no known family history of disease, and was unlikely to be an at-risk participant. Based upon quantitative and qualitative data recorded during the study, the participant was not reaching an adequate amount of physical activity to meet recommended guidelines of 150 to 300 minutes of moderate intensity activity over 5 days of the week. Over the 2-week study period, subjective measures in the form of questionnaires, surveys, daily diaries and Borg's 6 to 20 RPE scale were taken to assess the participants' understanding, perception and deliberations of their own physical activity levels. Objective data was also taken using a Fitbit Versa to obtain measures of heart rate, step count, distance covered and sleep efficiency. The combination of these measures allowed a thorough understanding of the participants' physical activity levels and areas in which behavioural modification could be used to improve adherence to the recommended guidelines. Of the data collected, the participant did seem to underestimate her own physical activity levels due to a lack of knowledge regarding what constitutes physical activity. However, as this was accounted for, guidelines were still not met to gain health benefits. The subject showed to be taking an average of 7,279 steps per day, which equated to 38.63 kilometres per week. These values indicated low activity levels alongside self-indicated low participation in planned sessions. The BMI and waist-to-hip ratio of the participant were both above recommended healthy levels, with a BMI of 27.4 and a waist-to-hip ratio of 0.84. Along with low physical activity levels, the participant has indicated high sedentary behaviour, which can lessen the effects of any physical activity undertaken. Physical activity increases lean muscle mass, reduces fat mass, improving body composition and thermogenesis. It has been proven to be one of the most effective means of chronic disease management and for health and well-being. Physiological benefits from physical activity include decreased blood pressure, lower resting heart rate, muscular strength, increased bone density, improved cardiorespiratory, cardiovascular and neural function. With these adaptations, risk of disease and conditions such as breast cancer, colon cancer, obesity, type 2 diabetes, depression, anxiety, and osteoporosis can all be decreased. The association between physical activity and disease reduction has proven to be quite strong and has a strong correlation with holistic health. Prior to program development, 4 SMART goals were constructed to address key factors that would increase motivation, improve adherence, assist in achieving all tasks. The goals were to increase physical activity frequency and intensity to meet guidelines of 150 to 300 minutes of moderate levels per week, incorporating a combination of cardio, balance, flexibility, muscular strength over 5 days, whilst providing incentives of enjoyment and benefits. Lose approximately 6 kilos over the 12 weeks to reduce BMI and waist-to-hip ratio. As of the 6th week, incorporate 1 30-minute session of high-intensity interval training per week to progressively improve cardiovascular fitness, maintain motivation, and introduce vigorous activity. And 4, increase the active minute to sedentary behaviour ratio by adding opportunities for physical activity to break up time sitting, such as standing when opportunities permit during office duties, watching TV whilst washing up, or doing household chores. Due to the need for the participant to increase physical activity levels, a 12-week program was developed based on recommended guideline requirements of cardio and muscle strengthening, with additional forms such as balance and flexibility also being utilised. Key components to the program included cardio to improve cardiovascular and cardiorespiratory function, reduce resting heart rate, lower blood pressure, and burns fat mass, and strengthening activities to increase muscular strength, endurance, increase free fat mass, improve bone density to reduce the likelihood of osteoporosis in later life. The 12-week program was split into 4 phases in which adaptations and improvements were accounted for. Behavioural modification was slowly introduced to foster positive change. This was a client-centred approach that was modelled around current activity levels, availability, work and social life, so as not to disrupt normal functions. The first 3 weeks of the program focused on building frequency of exercises around positive behaviours such as walking the dog and walking with friends. Each strengthening circuit included low repetitions and sets to avoid increased discomfort and premature completion. The activities as shown below the table are quite simple and require little technique and previous knowledge. The second phase of weeks 4 through 6 introduced high-intensity interval training once per week that incorporate vigorous intensity activity without reliance upon equipment. Each activity is slowly increasing with fitness as well as maintaining enjoyable fitness with friends and animals. The third phase, again, sees an increase in intensity and type of activity to push limits and still give variety so as to avoid boredom. The final phase of weeks 10 through 12 have included increased intensity again, specifically by moving from beginner activities to more advanced sessions and a broader spectrum of activities targeting specific muscles. When tackling sedentary behaviour, some helpful guidelines include moving about every 30 minutes of inactive time, completing any work standing that can be, complete moving tasks while watching TV or checking messages, making a commitment to walking places that are close by, and finally, making physical activity a priority.